Welcome to the Newsfeed. We're here in downtown Tacoma to get a closer look at health disparities for communities of color. In today's episode, an assessment of Pierce County community health needs finds that hypertension is an issue for 44% of American Indian and Alaskan Natives and 42% of Blacks in the county. We'll explain how a nurse is on a mission to bring resources and awareness to the chronic health conditions facing BIPOC groups in Tacoma. I'm Paris Jackson. Today we're here in Tacoma, known as the City of Destiny and for its world-renowned glass art and working-class roots. Yet chronic health conditions like hypertension, diabetes, and heart disease are quietly plaguing certain groups of people here. I sat down with health provider Tamika Gant, the organizer of an upcoming BIPOC health fair, to learn why she decided to replicate a similar event that happens in King County to serve her local community. Welcome, Tamika. Thank you for joining us today on the Newsfeed.
Thank you for having me. It's greatly appreciated.
Pretty soon you're gearing up to have a free health and wellness fair for Black, Indigenous, and people of color right here in Tacoma at the end of August. We'll get to those details in just a bit, but many people may not be aware of the specific health disparities facing BIPOC populations here in Pierce County. What are some of those?
With the Pierce County health assessment needs, we've noticed that the leading cause of death within the Black community, also Native American and Pacific Islanders, is heart disease. Also, hypertension is at its highest rate with these populations. Within the BIPOC community altogether, we've noticed a decrease in individuals accessing healthcare resources, and that's associated to the cost. We've also noticed an increase in diabetes within the past few years.
What has contributed to these chronic health disparities?
The top contributions for the healthcare disparities within Pierce County is systematic racism, socioeconomic issues, education, the limited ability to obtain a degree, limited funds, and also housing. I also came across individuals not having healthcare insurance or even being underinsured, lack of knowledge, lack of nutritional services. The list goes on, and these all play a part within increased mortality rates and also a decrease in quality of care.
You're a nurse, business owner, mother, and also you come from humble beginnings, similar to those of the patients that you serve. Why is it necessary to have this kind of event on the east side of Tacoma?
So I grew up in King County, moved to Pierce County not too long ago, and I've seen the difference, especially associated with the east side of Tacoma. It's literally like a desert concerning some resources, specifically healthy food options, and also medical services. So we wanted to be able to give back and be able to provide them with the same resources that other counties have access to. We wanted to be able to provide them with skills, tools, knowledge, and abilities to be able to provide better health care for themselves, their loved ones, and their communities as well. There's a saying that goes, if you want to see the change, be the change. And that's exactly what we're doing through the services that we're providing.
There's a number of different services that the community can receive. Tell us a little bit about those.
Absolutely. So we are so excited about our partnerships that we have accessed through this fair. And we have partnered with Virginia Mason Franciscan Health, as well as MultiCare. They are partnering with us to provide stroke health resources and education for the community. We have partnered with POCAN, and they are going to be providing our HIV, STI testing. We have also partnered with Linguistic Children's Dental. They are going to be providing dental services for our children. We have a whole lot of panelists that have agreed to assist us on this day as well by providing the community with resources related to stroke, hypertension, mental health, diabetes. We've also partnered with the Gun Responsibility. They will be administering free gun lock boxes as well during our event. So this is just an event for people to come out, obtain resources, obtain the skills, tools, and knowledge to be able to provide better care for themselves and their loved ones.
It was a pleasure to speak with you, Tamika.
Thank you for having me.
Again, if you're interested in attending the BIPOC Health and Wellness Fair at the East Side Community Center in Tacoma, all you have to do is go to abundancehealthllc.com. Also from the Cascade PBS newsroom, since we're here in the City of Destiny, if you're interested in seeing paintings, carvings, beadwork, and textiles by Indigenous artists, the Washington State History Museum exhibit In the Spirit Contemporary Native Art is on display now through September 29th. Check out our arts and culture coverage by clicking on the Culture tab on our website. I'm Paris Jackson. Thank you for watching the Newsfeed, your destination for nonprofit Northwest news. Go to CascadePBS.org for more.